Democrats think they are winning here. They think the ground is shifting in their direction. Joining us now is Vermont Democratic Congressman Peter Welch. Congressman Welch, thank you very much for being here. It's nice to have you here tonight.
Thank you.
As Republicans continue to do these symbolic votes on repealing health reform, more Americans are starting to like this law. I mean, right after the Supreme Court confirmed the constitutionality of it, we talked about a window opening up in which the administration and Democrats could again try to sell the American people on the idea of health reform. Do you think that window exists? Is that window open?
It's getting open. I mean, what you're seeing with, as you say, 33 times of a fake repeal is that there is lust in the hearts of the Republicans to beat this issue. They want to do it, but there's no passion to provide any alternative. And one of the challenges that they face, aside from doing these pointless exercises, is that what they're trying to repeal is what Governor Romney passed in Massachusetts. And you know what? It's very popular in Massachusetts. So that you've got this upside-down situation where what Governor Romney could trumpet as a contribution to health care and a success in his administration, he's running from, even as Americans are starting to say, you know what, this is pretty good. We keep our kids on health care till age 26. Pre-existing conditions, we can still get health care. If you're a senior on Medicare, you can get free preventive care. All these things sound pretty good, pretty sensible. Another thing that happened is that the insurance companies that have been ripping us off, if they more than 20% of your premium dollar going into fat CEO salaries, that has to be rebated to the ratepayers. And that has been a tremendous success in arresting cost in health care. So, you know, I think this is time for Democrats to stand their ground. And every time the Republicans do this pointless thing, they hit number 34. They are going to maybe hit 50 before we're out of it. That's going to be something that we can use and ask American people whether this is a serious policy or just a run for political cover.
It was the Senate campaign arm of the Democratic Party today that floated this idea that Republicans in the House who took this vote today, who might be trying to run for the Senate this November, people who might be trying to move over to the other part of Congress, that those will be the Republicans against whom this vote could pop up in an attack political ad from the Democratic side. Do you think it's possible that even in red states, some of these 33 symbolic votes against health reform would resonate against Republicans who took those votes?
You know, if we can stand our ground and we say, this is what we did, this is why we did it, and we defend it, and then we contrast that with this do-nothing approach that the Republicans are taking, repealing something repeatedly, people know that's not a policy. And then when we start putting the question to our Republican colleagues, where's your plan A? Where's your plan to provide coverage for folks, kids until age 26, and to provide preventive care and to claw back these excessive fees? So people want us fundamentally to get things done. The folks who are not just ideologically blinded on either side, but have as a goal that America makes some progress, that we revive our economy, that yes, we have personal responsibility, but we understand that we're all in it together. Those folks want us to get things done. And when there's one side that's trying, making an effort, trying to improve things that need to be corrected, and then there's another side that says, you know what, we've done it 33 times, let's go for a 34th. People get it. That's beyond gridlock. That's just obstruction.
Your state of Vermont has taken an aggressively progressive position on health reform. Vermont has talked about pursuing single payer at the state level. On the other side of the ideological number line, I guess you've got Texas with Governor Perry there saying that his state is going to opt out of Medicaid, even to the extent that it's going to cost them money and put them at odds federally put them at odds with the federal government and potentially in legal breach of what their responsibilities are at a state. Do you think we are entering into a position now where the red states and the blue states are going to diverge fundamentally on what it's like to live there, whether or not you are likely to have health coverage based on whether or not your governor is a Republican or a Democrat?
Well, Vermont is certainly different than Texas, and Governor Shumlin is certainly different than Governor Perry. So, yes, there is a diversion. And, you know, the decision in Vermont, when we embraced essentially the effort to move towards Medicare for all, that was bipartisan. And where we were able to move ahead is that a lot of the Republicans were arguing, you know what, we've got to get the cost down. Democrats traditionally argue we've got to have access for everyone. And we got together and we said, you know what, we're both right. The only way we're going to have sustainable access for all our citizens is to have lower cost health care, and we achieve that by trying to have accountable care organizations, better delivery of care, best practices, things that improve the delivery of the health care system. So that's the approach that Vermont's taking. Many states are taking. Governor Perry's heading in a different direction. I'll take the Vermont approach.
Congressman Peter Welch, Democrat of Vermont, thank you very much for your time tonight, sir. It's nice to see you again.
Thank you.
All right. I promise.